Okay, so hi, my name is Julianna. I am a registered nurse. I currently work at BennuLife, which is a regenerative medicine clinic here in Austin, Texas. For decades, physicians and scientists have been researching and creating ways to slow and reverse the signs of aging. This is through topical creams, ablation, laser treatments, chemical exfoliation, surgery, and this is all wanting to reduce the aging process or stop it or slow it down or reverse it. So we know that collagen fibers are the main structural and most abundant extracellular matrix component of the skin. It makes up about 80% of the dry weight and is responsible for the tensile properties of the dermis. It gives us our shape and the plumpness and fullness of our skin. A reduction and disorganization of collagen and elastin increases the appearance of wrinkles. It alters texture and decreases the overall appearance of the skin. So this reduction is caused by both intrinsic and extrinsic factors. Intrinsic aging occurs due to hormones, genetics, and other factors such as progressive telomere shortening and a decrease in vascularity. These all contribute to decreased elasticity, reductions in dermal mast cells, fibroblasts, and collagen production, and ultimately a flattening of the dermal-epidermal junction and loss of reed bridges. And so as you can see, the flattening of the dermal-epidermal junction is the most consistent change that is found in aged skin. Extrinsically speaking, this is your environmental trauma that comes from photo damage, and so in fact, 80% of facial skin aging is thought to be due to low-grade chronic UVR exposure, and this produces more of your rough wrinkles, rough texture, changes in pigmentation. So our target is to address the collagen and elastin production to reverse the aging process. So one of the ways that people have been doing for a while now is microneedling. So this was a concept that was introduced by Dr. Fernandez in 1995. He originally was going 5 millimeters into the dermis to help reduce the appearance of scars. He did find that it worked, but it was quite painful and messy for the patient. So the mechanism of action of microneedling is similar to the concept of microtrauma and orthopedic applications. The dermal microinjuries set up a wound healing cascade. And what they found over the years, numerous studies have been completed, is that they've shown statistically significant histological improvements, including an increase in organized and dense collagen bundles, a strengthened dermal-epidermal junction, increased in elastin production, and atrophic scar reduction. Subjectively speaking, too, most patients reported a decreased appearance of wrinkles and improved texture, fullness, and elasticity. And so there in the picture you can see the different depths of microneedling. So you can get from Amazon or whatever store now, it's available everywhere. Little needles that are 0.2 to 0.3 millimeters in depth. But really, to elicit the results we want to see, we want 0.5 millimeters and deeper. As you can see, for most patients, the 0.5 millimeters reaches down into that epidermal-dermal junction. So, as one would expect, they also found that microneedling helped deliver topical therapies more effectively into the dermis and dermis. So understanding how PRP helps wound healing, it was quickly theorized that PRP can have a synergistic effect with microneedling. So our goals for aging skin are to stimulate a thickening of the superficial layer of skin and collagen remodeling, improve fibroblast and cell regeneration, and increase blood supply to the tissue. So remodeling of the extracellular matrix and activation of the dermal fibroblasts are essential for rejuvenation of aged skin. And similar to how PRP has been used in the past for wound healing and musculoskeletal applications, PRP represents a complex mixture of growth factors, cytokines, and chemokines, as you all know, to help promote wound healing and proliferation of healthy cells. So in reference to using PRP to combat the signs of aging, specifically they found that platelet-derived growth factor improves dermal regeneration. It acts locally to promote protein and collagen synthesis, It causes endothelial migration or angiogenesis and induces the expression of TGF-beta, which TGF-beta is very important as it activates fibroblasts to undergo cell division and produce collagen, which is the ultimate result that we want. And vascular endothelial growth factor promotes blood vessel formation, so addressing the decrease in vascularity of aging skin. So what did they find? Numerous studies have looked at PRP and microneedling versus microneedling alone, and they did find that indeed it did have a synergistic effect. Histologically speaking, it stimulated dermal fibroblast proliferation, increased type 1 collagen, increased dermal elasticity, helped with the removal of the photo-damaged ECM components, and interestingly, they found that going to the depth of 0.5 millimeters was actually satisfactory to elicit some of the best results in the shortest amount of time, which was ultimately good for the patients because it's less painful and less irritating that way. So one study I'll focus on was published this year. They took 24 patients. It was a split-phase study. So they divided the patients into 3 groups. The first was with PRP and microneedling versus microneedling alone. As you can see, PRP with microneedling versus microneedling with a chemical peel, and microneedling alone versus microneedling with the chemical peel. So for all intents and purposes, I will just discuss the PRP patient side. So what they did was they used 8 cc's of PRP, and they sat with a derma roller that had needles going down 1 millimeter into the dermis. They did 6 treatments over 3 months, and punch biopsies were taken before treatment and after 3 months of treatment, showing that the combination PRP side had both the greatest subjective and objective improvements with the patients. I will say, though, that all of the groups showed some degree of improvement. So if you take a look here on your left-hand side, that top layer is going to be your PRP microneedling combo side versus the microneedling alone. So you see that there's a greater increase in the epidermal thickness with the combined treatment, and also an improvement in that dermal-epidermal junction that we've been talking about. On the right-hand side, you can see more dense and organized collagen that is more parallel to the epidermis, and that's the result of collagen formation that we want to see. Here on the left-hand side, you're looking at the elastic fibers. So you can see that old, dense, abnormal elastotic material before treatment, and then after treatment, that dense material was actually pushed down into the reticular dermis, and there was more well-organized elastic fibers present. And then lastly, I'm only showing you one of the patients, but they all had similar results. You probably can't see it that great in the screen, but there was a significant decrease in wrinkles and overall better appearance. You see, just plumper skin. It looks nice. So all of the studies that we've looked at have shown similar results with the PRP and microneedling, so it's pretty exciting, and patients love it. So I'm going to switch focuses now, talk about hair restoration. So we've got a lot of people out there who are looking for solutions for male and female pattern baldness. So I'm going to talk briefly about the follicle anatomy, hair cycle, treatments, and cellular therapy and technique. And I think we can all agree that we don't want hair like Donald Trump. Let's see. All right, so we've got the hair shaft. So this is composed of the cuticle, which is an outside covering. It's made up of overlapping scales. You've got the cortex, that gives your hair its color and shape, and the medulla, which is the inside layer running down the center of the cortex. Again, it's just the cuticle. It's different on different species of animals. A little closer look at the cortex there. And the medulla has different presentations. So, but really we're going to focus on the hair cycle. So the hair cycle has 3 different phases. That's the anagen, catagen, and telogen phase. In a normal person, normal hair cycle, this phase is cyclical and produces beautiful, long, everlasting hair. So, focusing on the makeup of the hair, the cells of the hair matrix are responsible for hair growth. The dermal papilla consists of mesenchymal cells that are isolated from the hair papilla of normal human scalp hair follicles. So it plays a crucial role in the controlling of hair production and events of the hair cycle. And these cells receive nutrients and oxygen from capillaries. So I'm referring to the little blue area that you see as it goes through the phase. It kind of disconnects from the follicle. So in the anagen phase, this is considered the active growth stage of the hair fiber, and it can last anywhere from 2 to 7 years. And at any given moment, our hair is at any given moment, hair on our scalp, 80 to 85% of hair on our scalp is in the anagen phase. And the catagen phase, this is also known as the transitional phase, in which the hair growth begins to shut down and stop activity, and it can last from anywhere from 10 to 20 days. The base of the shaft keratinizes and migrates upward, and it disconnects from the vascular source and that dermal papilla. So the telogen phase, once that disconnection has taken place, the hair becomes known as a club hair. And this occurs when the hair growth is completely at rest and the hair fiber is eventually pushed out and then falls out. And so at any given time, 10 to 15% of our hair is in the telogen phase on our scalp. This generally lasts for about 100 days, and then after this phase is completed, the hair growth process will start over again when the follicle regrafts the papilla, and you can see that represented through there. So, when there is an imbalance in the hair cycle that can be caused by many different reasons, systemic inflammation, illness, etc. But so what we're going to be focusing on is androgenetic alopecia, and it's male and female pattern baldness. It can occur up to 80% of Caucasian men and 20% of women. Right now, there's only 2 FDA-approved therapies. That's minoxidil and finasteride. Minoxidil increases blood flow and prolongs the anagen phase and promotes survival of the dermal papilla. And finasteride, also known as Propecia, it blocks testosterone conversion to DHT and activates anagen hair growth, increases diameter and elongation. So androgenic alopecia is a progressive miniaturization of the hair follicle, and it results from that imbalance of the hair cycle. The miniaturization ultimately leads to a shorter anagen cycle and a longer telogen phase, and over time the hair becomes shorter and shorter, and eventually baldness will occur. So why does it happen? It's still a bit of a mystery on exactly why baldness occurs and why it occurs, but we do know that androgens are the most important regulators as they stimulate, leave unaltered, or inhibit terminal hair growth. And the general consensus is that androgenic alopecia is both genetic and androgen mediated. So what causes this to happen in the scalp versus other areas of the body? We're still figuring that out. So testosterone converts to DHT. It then attaches to androgen receptors in the dermal papilla cells. It accumulates, and the follicles become sensitive and start to miniaturize, and hair thinning and hair loss occurs. Two genetic risk factors are present. You can see them right there. And then some hypotheses are out there for possible contributors. This is inflammation of the scalp, which further increases the androgen response. There's been seen a relationship between capillary calcification and baldness patterning, and a decrease in transcutaneous oxygen has been found in the frontal scalp of these patients. So this is just one of the hypotheses of chronic inflammation, and so knowing what we know about both PRP and bone marrow concentrate, we can see how if we can downregulate that inflammation, it can have an effect on the overall androgen response and restoration of the hair. So we want to walk that part of the flow chart. So our biologic targets are to address any inflammation that's occurring through IRAP and tumor necrosis factor receptor antagonists that's found in PPP and EMC, and then also through VEGF to increase and promote that vascularity to increase the oxygen. And you can see there we're finasteride and minoxidil targets. So the PRP mechanism of action, so PRP is thought to help normalize and reactivate the hair cycle. It's hypothesized that growth factors may act on the dermal papilla and stem cells in the bulge area of the follicles, stimulating the follicular unit and promoting neovascularization. So injecting the PRP, you can see that PDGF may stimulate stem cell mitosis, TGF-beta may activate the dermal papilla and inhibit apoptosis, and VEGF promotes microcirculation. And so this is thought to induce proliferation of the dermal papilla cells and ultimately prolong the androgen phase and sort of wake those follicles up. So what are the results? So there's been more and more studies have been coming out. A meta-analysis was recently conducted looking at 177 patients who underwent PRP intradermal injections, and they found that among those patients, statistically significant results were seen in both the increase in hair number per centimeter and hair thickness. So here's one study that was done for women. 10 cc's of blood were concentrated down to 1 cc of PRP. 4 intradermal injections over 4 weeks took place, and the evaluation was 6 months after the last injection. Unfortunately, the depth wasn't specified, it just said intradermal injections. But you can see pretty significant results there. Here's another study that was done with 78 patients. They did 18 cc's of peripheral blood concentrated down to 3 cc's of PRP. And they did specify that they went 4 millimeters intradermally. And they did quite a bit of treatments. So it was 3 monthly treatments followed by 3 bi-monthly injections, and then 2 to 3 annual maintenance sessions. And the outcomes are based 2 months after the last treatment. And so you can see increase in both hair density and thickness. Now, one thing I will say about a limitation with this study is that all the patients in this study had failed minoxidil or finasteride treatments for a year, but the investigators didn't make them get off of it. So they were still receiving that treatment while they received PRP injections. Just another example, these individuals received multiple injections about 1 centimeter apart and at 1 to 2 cc's of PRP per injection, so it was a little bit more volume. And these were evaluated at 6 months of same study. So the question that still remains is, how do we inject intradermally? Much do we inject, how deep, and how often? So how often? It's pretty. It's out there, it's different at every single, study that you look at, but one thing that is consistent is that multiple treatments are necessary, and serial sessions are necessary, so either monthly or bi-monthly seem to have the greatest effect. How much? It was about 2 to 4 mils of PRP with the injections was about the norm to produce results. And how deep? Well, that is still to be determined. We know that the depth of the follicle is 3 to 5 millimeters, so it would make sense to want to go that deep with the injection. One thing we do know is that these growth factors are thought to play such an important role that it seems that you would want a system that is able to concentrate the most amount of growth factors in the littlest volume, since the scalp doesn't take that much. So this is a kind of cool machine that we're using at BennuLife to conduct a hair study. It actually delivers automated injections, and so we can program the depth and the volume that we're injecting. And it has 9 31 gauge needles that go into the dermis of the scalp with each shot. So I'm excited to see the results of that. So why is this important to you? Well, natural facial rejuvenation is the #3 trend in aesthetic medicine. In North America, it's the single largest market for regenerative aesthetics, and with the sales of 90.3 million in 2017 and a predicted annual growth rate of 18.7% through 2020. North Americans spend over $1 billion in hair restoration products and procedures annually. And since, like we said before, you're already offering these services to your patients, we find that both men and women alike are very interested in getting them as an add-on treatment, and if they're paying cash for these treatments already, the extra, $1,000 or whatever's charged for it just doesn't seem that much, and we usually want to do it at the same time. And also, what's nice is that generally your nurse or esthetician that works at the practice can do the injections for you. So that concludes my presentation. Here's my references. I will be doing a treatment with PRP and microneedling here shortly, and it's with a specific device that we use. It's really cool in how it delivers the PRP. So I'd be happy to answer any questions then, and I'm going to be also talking about patient experience and like real life use of it in the clinic.
Thank you, Julianna.
Thank you.